You've introduced me already, so um, I'm Dr. Raheem Chowdhury. You can call me Raheem. I'm a GP in London at the moment, but I studied in Birmingham. I graduated from the University of Birmingham in 2018. So it's been a while now, 7 years as a doctor. The way it starts, um, the level of everyone here is prior to university, is that right?
Some, yeah. Almost most of them are going to apply very soon.
Yeah, so if you're applying to medicine, um, you'll know about UCAS and your application, all of that. But after you graduate, it depends on whether you do a 5 or 6 year course. So some universities have an initial mandatory 6 year course, which means you have to do an intercalation. So that means you actually end up with 2 degrees after just doing a 6 year course, which is quite cool. That gives you more opportunities in the future as well. But it's not necessary if you want to be a usual doctor. So most universities are just a 5 year course, and then you finish as a doctor. After you finish as a doctor, you do 2 years of being a junior doctor. So that's called F1 and F2, your foundation years. Um, I did those in Birmingham, and that is, very tricky years for different reasons, but also enjoyable, and you learn lots of experience as well. So it depends on what jobs you actually get and what you apply for. So it used to be that it depended on your medical school score and what decile you finished about what jobs you would get and where you'd be placed. But now they actually have just randomized it. So it doesn't matter how you do in medical school. They just try, and because people apply to different places, so they try and just allocate it based on preference. Um, so, some people get placed in different areas where they weren't intended just out of sheer randomness, which is one of the downsides of medicine, is you get placed in different locations. So, for example, if you wanted to stay in London, that's not necessarily guaranteed. However, what is guaranteed is you will likely get a job, and that's pretty much 95% after graduation. You'll walk straight into becoming a junior doctor. After that, the pathways, sometimes it's not completely clear or guaranteed if you become a specialty and a consultant, but everyone from med school gets a job as a junior doctor. That's guaranteed if that's what you want to do. There's obviously different options as well, so you don't have to go straight into becoming a doctor. Lots of people do things like health consultancy, or they'll explore business within the medical field. So you're not limited with a medical degree. You actually have lots of opportunities to do lots of different things as well. But I'll mainly focus on the general medical pathway. So you pick your jobs, you pick your location, and probably about 70% of people get their sort of top five choice. So you're likely to be where you wanted to be and likely to get the jobs you want, but there's small chance you might be placed in a different city, or not get the jobs you want, and that's just random. Um, but it's generally okay. It's only a couple of years anyway. And then when you apply for specialty training, that's based on an entrance exam and an interview, which is online for most specialties. And then you can generally get kind of what training you wanted, whether that's GP training, which is what I did, or hospital training or surgical training. Um, so obviously, I know that's far in the future for you guys, but it's useful to know what kind of pathway you'll be experiencing as a doctor. So for my experience, I'll give you that as an example. So F1 and F2 as a junior doctor in Birmingham, with some of the jobs that you mentioned earlier, so A&E, anesthetics, surgery, trauma and orthopedics. So you get a wide array of experience, and that helps you determine what kind of doctor you want to be and what specialty you want to be in. So during medical school, your opinion will change. Even now, you might have some ideas if you wanted to be a surgeon or a cardiologist, and that will change throughout medical school as you learn the different specialties. And then it will change even more as a junior doctor as well, because you actually see what life's like when you're working in different specialties, and that really does help guide you. And you don't have to apply, massively far in advance. You can apply sort of midway through your foundation 2 year, for specialty training. And lots of people actually do something called an F3 and F4 year, where they don't immediately start specialty training, they just locum. And locum means you just do kind of temporary work in different hospitals as a junior. So you stay as an F2 kind of level, but you're called an F3. So you're not progressing in training, but it gives you lots of flexibility to travel, to spend time with your family, to do whatever you like, even work abroad. So lots of people do different things after F1 and F2. And the pay as a junior doctor, as a locum, is quite good as well. Um, Usually it's around between 40 to 60 pounds per hour per shift. So if you do like 4 or 5 days, you can rack up decent money doing that as well. But it does kind of reduce your progression into training. And obviously, as you go up the training, your overall salary goes up. So it just kind of depends on what you want and where you are in life. But that's one of the massive benefits of the NHS is you don't have to follow any specific pathway rigidly. You can do what you like. You can take years out. You can do training. You can do traveling. And because it's not like a corporate job, where if you're kind of in the city and you're in the corporate world, it's kind of expected that you do their pathways, and if you don't follow that you might not get promoted and all of those kind of things. In the NHS it's not really like that, and it's not necessarily about networking. You don't have to create like good relations with senior people. It's all just nationalized, standardized. You do an entrance exam, you apply to a place, and then you get that place based on that. Um, and you can take as much time out as you like, and it doesn't hinder your future promotions. It's only up to you in terms of your own timing, which is very useful for family life and other things that you want to achieve in your life outside of medicine. It gives you that flexibility to do so, and there's also scope to do part-time work. So lots of people do GP because of the work-life balance, and that's great. But if you were really keen on doing A&E or surgical training or medical training, while it's more intense and weekends and night shifts, there's an option to drop part-time, and you can do it 60% or 80% on full-time. And obviously your salary drops a little bit, but you have much less weekends and much less night shifts, and it takes you a bit longer, but then at least you have that kind of flexibility to do other things. So that's another big benefit of the NHS. You'll obviously know lots of negatives of the NHS in the media and night shifts and the pay, but actually very recently the pay has gone up quite significantly after the junior doctor strikes, which you may have seen on the news, which is great. And that's kind of in line with inflation and all of that. So the pay for junior doctors and registrars has gone up, which is another benefit, because obviously it is a hard profession, but it is, from my experience anyway, it's definitely worthwhile. And where I am now, so after F2 training, I straight away applied to general practice training. I didn't do any years out that I was talking about earlier. I just did pure GP training, which is a 3-year program, and then you become a GP consultant. So that's actually quite quick. So it's just 5 years in total after medical school, and now I'm a fully fledged GP, which I've been for 2 and a bit years now. And then you have even more scope to do what you like. So as a fully qualified GP, you can pretty much work anywhere you like in any GP practice. And GP jobs and the GP field, it changes a lot, and that depends on what the NHS position is in that year, and on politics, and what different political party is involved and how they want GP surgeries to look, and that kind of affects the job opportunities. So sometimes there's so many jobs and they're begging for GPs, and they'll give you bonuses and pays, and then some years they're saying, actually no, we're looking for different types of employment, and they want more nurses or paramedics or physician associates. So that kind of does change up and down, and that just fluctuates year by year, and you can't guarantee exactly what it's going to be like, but generally you'll know that it's hard to get a GP appointment for patients. So generally you'll be okay getting a job. You might not get the exact place you want, like if you wanted to be in central London, North London, you might get placed slightly further away, but as a GP, you generally will get a job. Your role will be not necessarily the exact same. So these days they're making GPs a bit more supervisory. and triaging. So instead of just seeing patients back to back, you supervise paramedics and pharmacists, and they do the clinics, and then you talk through some patients with them and give them advice. So that's one of the new roles that I've kind of had to do in this last year or so. And there's a different sort of triage system where some days you're not seeing patients, you're just going through the list and deciding who needs appointments and redirecting people elsewhere, which is also very interesting. I've enjoyed all of that. I enjoyed my GP training, and that 3 years of GP training involves 12 to 18 months of more hospital work, so similar to what you did as an F1 and F2, and then 18 months to 2 years of being a GP, so knowing what that's going to be like when you're a consultant. And as a consultant, as I said, you can pick your own days, pick your own hours. You obviously just get paid for the work you do. So salaries for a GP, if you work as just a salaried GP, that depends on how many sessions or days of the week you work. So your pay will vary between 20 to 25,000 per day that you do. So if you were to work kind of 5 days a week, you could get over 100,000 if you did a full 5 days, but that is quite intense as a GP, and not many GPs work a full 5 days because a full GP clinical day is quite difficult. You see lots of patients, and you can get a headache at the end of the day. But my career, for example, is I only do 2 days of clinical work of seeing patients back to back, and then as a GP, you have lots of flexibility to do other specialties as well. They're called gypsies, GPs with specialist interest, and mine is medical education. So I teach lots of medical students. So if any of you guys apply to any London medical schools, I might teach you as your GP supervisor. So they come to my GP practice for a day, and that's a lovely day for me and the students. And it's a bit more relaxed. We see a few patients, we have a coffee, we have a tutorial, and that's really fun. And I get paid for that as a GP as well. So that's one of the options that you have as a GP. You can do teaching, or you can do a day of dermatology where you're just seeing skin conditions. You can do a day of like contraceptive counseling, and there's lots of different things you can do as a GP, and the scope is huge. And if you're business minded, you can become a GP partner. And that's where you kind of own the building, you buy into a partnership, so it's similar to other businesses or law partnerships, and you get a bit more money that way as well. So that's usually over 100,000 once you're a consultant, but the workload is a bit higher and you have to be involved in the business. So it just depends on what you want to do, but the flexibility is excellent. Obviously there's challenges of being a doctor, which you guys can uh, guess and figure out once you are a doctor, and that all depends. And the junior doctor years are quite challenging, but there's a lot of camaraderie, and you have lots of colleagues that you're going through it with. So that's very useful, and you have time to go on junior doctor forums, and you have teaching all together, and you help each other through it. But it's all good fun, and you'll learn what you're supposed to be doing through medical school as well. So you're prepared for those years, and you learn as you go. And everyone's very supportive in the NHS. Obviously, it depends on particular person, particular department, and particular hospital of what your experience is. But I can only speak positively of everything I had in Birmingham, and then I also trained down here in North Middlesex Hospital, North London, for my GP registrar years, and everything was very well supported. And obviously there were challenges of seeing unwell people, and dealing with deaths and things like that, which is obviously difficult, but you get used to it, and it's part and parcel of life. And obviously you're in a privileged position to help people, and there's lots of benefits as well. Even within the family, lots of people are asking me about medical advice, and it's nice to have that position where you can help them. So I couldn't recommend medicine highly enough, but it is a challenge, and you have to love it, and you have to be a certain type of personality to do it. Do you want me to finish till 11, or should I give people question time now, or is it question time afterwards?
The questions come throughout the talk. We have
All right,
one question that came through.
go.
The question is, if I can't get into medicine and have to go for biomedical engineering at uni, is
Mhm.
it still possible to follow the doctor route in the UK?
Yes, 100%. So if you don't initially get in for medicine, which it can be quite difficult. Obviously, you have to have work experience and good grades and all of that. If you want to do a different degree like biomedical sciences, there's postgraduate medicine. So after completing a different undergraduate career, usually one related to medicine, so biomedical sciences or natural sciences or medical physiology. There's a few different degrees. After doing that, you can apply for postgraduate medicine, which instead of 5 years is 4 years. So that will be 7 years in total as opposed to 5 or 6. So it's not massively big difference, maybe 1 year difference. So um, you have to usually do well in your undergrad degree though, because postgraduate medicine is also competitive to apply for. So lots of people who have done those type of degrees apply for medicine afterwards. So if you do well in it, there's definitely scope to then apply for postgraduate medicine and do that 4 year degree, and then you're a doctor just like anyone else. And actually, you have more experience and lots of other sciences, which does help you in your career too. Even some pharmacists do that, and after medicine, you can also do a pharmacy degree or a dentist degree, and you can become really specialist. But obviously, that's a lot of years of training, but it adds up in the end, and you get higher pay once you qualified anyway. So while you have maybe more student debts, your pay will be higher, and you can combat that as well. So there's definitely scope to do that. Obviously, after BMed Sci and those other degrees, there's lots of other jobs you can do as well. Lots of research you can do, health businesses as well, and look at AI and medicine and AI and biomedical sciences, and lots of really good high paying jobs you can do from those other degrees as well. So you don't have to do the classic doctor route. It's not the be all and end all. From a biomedical science degree, you can be very successful even without doing postgraduate medicine. There's lots of scope with jobs from that as well. It's not completely vocational like medicine. So you do medicine, you go straight into being a doctor, and there's a clear pathway. From biomedical sciences, if you don't do postgraduate medicine, you have to kind of forge your own path and think about what job you want to do. But there's lots of scope as well.
Great, thank you so much.
Any other
Yes,
questions?
there's one question that just came through.
Yep.
Is medical school really as hard as people paint it?
So I presume it has changed a reasonable amount now with AI and all of that stuff, which can help you a lot. I think looking back on my experience, if I had AI, that would have helped me a lot through learning, because medicine, it is tricky and there is lots to learn. And it's when I was studying it, you couldn't just Google answers because Google wouldn't know either. There's lots of anatomy and physiology that you have to understand. You have to go through lots of textbooks. But now with AI, that will probably help your learning a lot. Um, so that will certainly improve the ease of access to information and learning. So it might be a little bit easier now. I would say it is. I can't comment on other degrees, but I obviously know people I studied with who are doing other degrees, and medicine is a lot more intense in terms of being like lecture heavy, and you're generally in 5 days a week and you have lots of content to learn. Whereas other degrees, sometimes you have the odd day off here and there. So it's a bit more intense than other degrees. I wouldn't say it's necessarily harder than other degrees though, because obviously things like engineering and chemistry and these and mathematics and physics are very difficult as well. Just actually understanding those concepts. Medicine isn't necessarily fully conceptually um, difficult to understand. You just have to put in the hours and learn lots of content, learn lots of systems. So if you put in the hours, it's not difficult, but it is difficult because it does require lots of hours to be put in and lots of studying to do. It gets easier as you go on for me anyway, because most medical schools do the first couple of years of undergraduate pre-clinical sciences. So you're just learning about science, and then you get placed in hospitals and GPs, and that's a bit easier because you have a bit more of your own time and you just kind of shadowing and learning at your own pace. So it gets easier through the years, but the first couple of years at University of Birmingham and UCL are very tough. You've got 5 days a week and lots of content to learn and lots of exams. It's difficult, but it's certainly doable.
Thank you very much. We did have a few more questions come through, but unfortunately the time is 11 and our next speaker is waiting. If not, we can hopefully send these questions to you in private
No problem.
and you
Yeah,
can
yeah.
get these answers
I'm happy to
requests.
answer any questions. You can use my email address, and that'll be fine.
Thank you so much.
All right, take care. It's a pleasure. Good luck, everybody.